I am sitting here with the amazing Kait. I'll call her Kait, but she's actually Dr. Kait, and she is an anesthesiologist and a mom of two. And she did the push prep course for her second. Her second daughter is 12 weeks old. So amazing that you're here sitting across from me on Zoom. Congratulations, friend.
Thanks.
Oh my gosh, so good. And I really was excited when you shared your birth story with me, and your experience after doing the push prep course around your birth, because I've had other commentary and thoughts from other care providers, and oftentimes you're kind of going into birth already knowing so much more than sort of the average person that's not in healthcare. And that can cause some anxiety. And you nodded your head before we started recording. Yes. So before we dive into that, maybe tell us a little bit about yourself and where you're located, and then we'll dive into your birth story.
Sure, sounds great. Um, like you said, I'm a physician. I'm an anesthesiologist, actually. So it's kind of interesting that I ended up here, given that a lot of the time that I spend is putting in epidurals and supporting women in labor, having C-sections and managing pain and various things on the labor and delivery floor. I'm in Sudbury, Ontario, which is Northern Ontario, a number of hours north of you in Toronto. And I have a 3-month-old, so we're still in the trenches. And I have a almost 2.5-year-old daughter as well. So and interestingly, my mom is an L&D nurse and my sister is a NICU nurse.
Wow.
And I thought I would go into obstetrics, but I delivered a baby in med school and was like, no, not for me. I want the other side of the curtain. So yeah, that's a bit about me.
That's awesome. And so you had your babies about 2 years apart. Yeah.
Yes.
Yeah,
Mhm.
I can relate. Same with me. I know you're very much in the trenches still. But I'd love to know, so you've had two births, and I'd love to know how they have differed. And really the question is, when you're first time mom, first time pregnant, you already knew so much given like your life has been spent giving people epidurals, and I'd love to know sort of, is there anything that, my first question is, you wish that you had known before your first, that you knew for your second?
Mhm. I guess the answer to that is what I learned from my first is that I needed to be prepared. And what I mean by that is I didn't want to just go with the flow, even though, we always tell pregnant women that you need to go with the flow because birth is unpredictable and you can't control and you can't plan anything. But so for my first birth, I found it really challenging to wrap my head around it afterwards because I felt this dissatisfaction about how it had gone. Not trauma per se, though it did resonate with me at some point. In one of your stories, you mentioned how there's different types of trauma that everyone would recognize as trauma, and trauma that's maybe more subtle and more internalized. So maybe I had a bit of that, but I think so for me, for my first birth, I just thought, I'm a medical professional. I I work on the labor and delivery floor a lot. I know that things can go sideways and not according to plan per se. And so I'm just going to go with the flow. And I'm not going to prepare or think too much about this. I just want to be ready for anything and go with the flow. Um, I mean, I knew that I wanted skin to skin, for example, because that's good. And I knew that I wanted delayed cord clamping, but I literally never even said those things aloud to myself, let alone even to my husband. Like, I don't think my husband knew that I wanted that because I never vocalized or really thought through anything beyond just the ultimate basics like that. And for me, ultimately, going with the flow just ended up being really meaning being unprepared. And so that when I did end up delivering, and I had an induction at 39 weeks, sort of based on the Arrive trial, but also kind of for logistical reasons, because we're alone up here in Sudbury. I needed my family in town. Um, it just ended up making me feel like a passive observer during my birth. And I was surprised at how little, or actually completely unable to advocate for myself I was, because I hadn't thought through what I wanted. I hadn't visualized what I wanted, and I hadn't ever even shared that with my husband, or my OB, who is a fantastic OB, and she would have supported me had I discussed anything. Um, so there were a lot of little things during that birth that were just maybe micro traumas that 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 add up to feeling really dissatisfied with it and disappointed that I didn't prepare better. And so I knew that for my second birth, I wanted to prepare, knowing that things might still go sideways. I still needed to have a lot more control over what the context was and how I sort of created my own narrative for my own birth, for our second delivery. And that involved a lot of things. But a huge part of it was your push prep course, and seeing all those positive stories and having all the resources. There was a lot of preparation that I did that made my second birth so much better.
Happy to hear that. Was there like what maybe you get let's just talk about your second birth. Like how did it go down? Like the actual story. Like you were in labor for
Sure.
how many hours? Like all of
Yeah.
those juicy details that we're here for.
So my my first labor, as I mentioned, I was induced, and I actually responded really well to the induction. Uh, I went pretty quickly. I went home for like 2 hours and then promptly had to come back because I was in active labor. I got an epidural right away, again, because I hadn't like thought about managing pain and managing contractions. And I was like, I put in epidurals. I'm going to get an epidural. And I just got an epidural right away. And then um, there was it actually went quite quickly. Even though I was first time laboring, I went quickly. When we started pushing, I didn't even really know that we were pushing. Like my OB was like, let's do some practice pushes. And I remember at one point asking, like, are we finished practicing? Like, I didn't know that I was doing it, and then there was a period of time where I suddenly heard my daughter's heart rate tanking. Um, Maybe not everyone would recognize that, but I'm very attuned to that as an anesthesiologist. I'm used to listening to the fetal heart rate, and I heard her fetal heart rate just tank. And then I remember just suddenly feeling absolutely terrified. And very quickly, my OB was like, we need her out. And it ended up being a vacuum delivery. I had a second-degree tear, but it took a really long time for me to heal from that. And then my uh, I also ended up having some strange kind of nerve damage that was not permanent. It was just sort of from the position I was in, which was on my back.
Femoral
Um,
neuropathy? Is it called femoral neuropathy?
it was worse than femoral neuropathy, but same thing. And because I was an anesthesiologist, it was like, oh my goodness, was this the epidural? Like I ended up getting an urgent MRI at 4 a.m. the day after I was discharged. And it wasn't the epidural, but it all got better. It was just a really long
Yeah.
struggle in terms of my recovery physically and mentally, a lot mentally. And then my second delivery, um, because I had put in, I think, so much preparation, coaching for my pelvic physio, and which I didn't even know existed for my first delivery. Like, and she's been so incredible. Um, Having positive role models, like my sister had an amazing delivery. She was a first time mom and just like killed it. And all your resources. I went in, and again, I was planned for an induction, again, kind of for logistical reasons, because we have no family in town at 39 and a bit. But I went into labor before my induction, the night before. And my mom wasn't in town yet because she was flying in the next day. We had to call my in-laws who live in Toronto, who drove at like 4 a.m. to
God
get
bless them.
here. to look after my toddler. And then it was the minute they got here, my contractions just disappeared. And it was totally that like fight or flight, like I'm stressed. Now my house is full of people. I I'm not going to be able to labor the way I want to labor. Like I have all these plans, and I just contractions disappeared. Anyway, finally they took my toddler and went to the cottage, and then it was like, and I was able to focus much better. And by the evening, things were, I was like, I don't know, maybe like, did I call them too early? Like, is this really active labor? So I thought I would have a bath. I got in the bath and suddenly it was just like,
I love where this is going.
boom, going. And I got out of the bath. My husband, side note, my husband had gastro and was like puking the entire day, like just adding to the stress,
Classic. It's a classic.
puking every hour. But I got out of the bath and was like, pull yourself together. We need to go to the hospital like right now. And again, because of watching your doing your course and my sister as well, I had got a TENS machine the day before, thinking like, maybe I'll try it. But we got out of the bath and I was like, put it on, get me in the car, put it on, let's go. We got there and I was actually only at 4 centimeters. I thought I was much further along, but by the time from arriving in the hospital, walking through the doors to delivery was only 48 minutes. Um, yeah, it was real
Oh
fast.
my God.
So I went from 4 centimeters to baby in 48 minutes. And yeah, it was basically right away as soon as I got, they got me into the bed and were about to connect me to the fetal monitoring to do a strip. And I just was like, no, like, this is,
Yeah.
everything was happening so fast. And it wasn't, I don't ever remember being afraid. And I think it was just because of all the preparation I did. I was breathing, like doing the horse breathing, like, like you were saying. And throughout the entire time, I just remember hearing my own breath
Mhm.
and just focusing on hearing my breath and then taking and knowing that it was going to end, the contraction was going to end, and then hearing my breath and then knowing it was going to end. And it was so, I was just really focused, and it seems a little maybe fluffy to say this, but I was in like a flow
Oh,
state.
yeah. You're in labor land. Yeah.
Yeah. And not, it just, I think it was really only when I was pushing that I was like, oh, so okay, here we go. Like there is no epidural. We're so far past that. And which was kind of nice because I had sort of been playing with the idea of like maybe I could do this unmedicated this
Mhm.
time around. I've read had been exposed to all these stories about women who can do it, if they want to do it. And I kind of felt like maybe I'd like to try. And then it was out of my hands and I just did. And I did it. And I was really so much more present and happy with how it went. Plus, my husband was on board. Like, not that he wasn't on board before, but the first time I didn't bring him on board.
Mhm.
I never verbalized anything. This time, he actually came with me to, one of my pelvic physio appointments so that she could teach him how to do counter pressure and like hip squeezing and teach him how to hold my legs in internal rotation if I needed to. I told him I wanted to push on my side. He was the one who I remember actually because everything was moving so fast. My OB had said she'd come in for me, which was amazing. She wasn't on call. She's a friend. And so she was coming in, like driving madly into the hospital, but I was obviously like moving way too fast for that. And so they called the on-call OB. And when they called, like he came into the room and they said like, okay, you need to move onto your back now. And I was like, yeah. Like, I just
The gremlin
And
came out.
yeah,
No.
I did one push with him, and then my OB was there, and she was still in her street clothes. Like she just threw on a pair of gloves and was like, "Okay, on the side, sure, no problem." Like, she's
Yeah.
great, and she had no problem with it. Um, but my husband, I was able to say no, but he also was saying no. She needs to stay on her side at the same time. And when one of the nurses tried to hold my leg for me, she was just trying to help, but it was the wrong
External
way.
rotation. Yeah.
Yeah, he immediately was like, "No, I'll take it," despite him having had to leave the room to puke once for his gastro.
Oh,
And
this is
I mean,
amazing.
at the end of it all, I had, my daughter on my chest, and I realized I didn't even have an IV because
No time.
everything had moved. No, but my husband had an IV because before we left, I was like, "You need to drive me to the hospital, and you can't keep anything down." I put an IV in him at home to give him like an so to make him stop puking. I gave him a bit of medication.
Oh my God.
And then at the end of when they moved us over to postpartum, like I had the baby and he was lying on the couch with an IV of like saline dripping in because he was
Tell
so
me, tell
dehydrated.
me you have a photo of this moment. Tell
I
me
do.
you have a photo of your husband with the IV and you having just given birth to a human.
Yeah, being like, um, but so really it was just like so much. There was a lot of funny things that happened, and I just feel like I was so much more present and focused and centered for all of it and in control. I was lucky in that nothing did go sideways, and lucky that I went into labor before getting induced. Like there were all the stars lined up for me, but I also feel like even if they hadn't, I would have still been happier with the way this delivery went because of the mental and the physical preparation that I put into it that I didn't the first time.
No, this is such a good story. I'm like getting emotional. I feel like I've got like little misty eyed here. Oh, it's everything you're saying, and you're so articulate with the way you describe it. It's God, birth stories are so because you always remember, don't you, how you felt in those moments, and it stays with
Mhm.
you, right? And often I hear there's really no neutral, there's no in between. It was either one of the most empowering, positive memories, or it weighs on you in a way
Mhm.
that doesn't quite feel right. And I have yet to talk to anyone who is sort of ambivalent about it. You
Right.
know what I mean? Like it's either one or the other.
Yeah, that's so true. Mhm.
Yeah, big time. Whew. Are you and you're on mat leave right now, I presume? Yeah.
Yep. Yeah, I thought I would go back. I'll go back at the end of the summer. We don't get very much
Yeah.
summer
It's
in
not
Northern Ontario,
80%
so
done. Take
I'm
advantage
taking
of
it.
it. Do it. You should. I wonder how, you know, how has this experience changed? If it has, I'm not sure if it has, but has it changed, do you think, how you may counsel or interact with any of your patients, especially the ones in labor?
Mhm. Yeah, absolutely. It really has. Interestingly, so I always sort of felt like with anesthesiologists, by the way, there's some that really like being on labor and delivery, and there's some that are like, they don't want to be there. They're just, it's like too much for them. I'm the former. I really like the environment on labor and delivery. I love going up there to do epidurals and help out with C-sections. And so I always felt like I was, fairly cognizant of taking a patient-centered approach to really try and support laboring women. For example, if I went in they called me for an epidural and I went in and it seemed like she wasn't, maybe she didn't really want the epidural or she wasn't quite ready, but maybe the nurse called me because they knew I was around and I might be busy later. I would be the first one to say, look, we can talk through this, and if you don't want it or if you need some time to think about it, like I can come back. I am here for you. I will 100% come back. It's not a problem. And so I felt like I kind of already did that, but I realize now I didn't really have the ability to relate to how vulnerable a woman or a person in labor is, um, and how difficult it is, even if they are the best personal advocate and they have great advocates for them, it's still very difficult. So now that I know that, having had that feeling myself, being a patient the first time around, um, I'm just a lot more, I think, aware of it. For example, before my delivery just now of my recent daughter, when I was pregnant, visibly pregnant, I had a woman come in who was she had to have a scheduled C-section. She told me, I didn't want this to happen. Like, I had an emergency C-section last time and I wanted a VBAC, and now I'm here and I'm really upset. I mean, kudos to her for telling me that, because it
Yeah.
takes so much bravery and courage on her part. And she said, I just don't know who to tell that I'm really, like, I didn't want it to be this way. And I really wanted to do skin to skin and blah, blah. Like, she just was struggling. And I would have responded to that previously, but this time I just felt like I connected with her so much, because I also had felt that my first delivery didn't go the way I wanted. And I could sense how concerned she was and anxious. And so what I just tried to do everything I could to support that. I mean, we don't in my hospital, though we should, I think, be better at this. We don't routinely do skin to skin after a cesarean section necessarily. We just, the system isn't there to support it. And it's the kind of thing where my old self would have said, like, the system really should support this, but I wouldn't necessarily have taken the steps myself to do anything about it.
Mm.
But with her, I realized, if she's stable and baby's stable, like, why can't I just facilitate that? I'm at the head of the bed. I'm perfectly poised to help with that. It's what I would have wanted. I didn't do skin to skin with my first daughter for the first hour. And I don't know why. It just didn't happen. Like, I was so dissociated from everything. And I'm so disappointed in myself about that. So I wanted to give that opportunity for her. And so we just did it. I just told the room, like, we're going to do skin to skin. If baby comes out happy and mom's good, we're going to do skin to skin. And the nurse was like, really? You're just going to do it? Yes. But I just think that,
Yeah.
if the system isn't in place, we as individuals need to change that where we can. So I think that's something I'm going to take moving forward, is if I can be the system. There are changes that I can make as an individual to support laboring women in their vulnerable time and try and advocate for them, even if there isn't, a protocol for skin to
Yeah.
skin post cesarean section yet. Though I think we're going to move there, but just more of us need to step up and just
Yeah.
facilitate it.
That's amazing. Oh, giving me all the feels. I mean, it's I'm curious to know, and this is just getting more into like the system piece because I don't fully have a grasp of it, but what really needs to be in place for that to become standard? Assuming baby is stable, but like, why
Mhm.
is it that you need more bodies in the room? Is it like the arms being strapped down thing? Like, what's going on there?
I think there's two pieces. There's a culture piece, and there's a perceived safety piece, perceived. Um, so the culture piece is just, yeah, the culture is that you lie like this on the table, we put straps on you so that you don't accidentally bring your arms into the sterile field. You've got a blood pressure cuff going almost every minute sometimes, an IV, an oxygen probe, you've got ECG leads. It's a lot. um, but me, to facilitate it, it just, mom's stable, I just don't strap them down, first of all. And then I just took a chunk of time to stop the blood pressure cuff and take off the oxygen set, because I can see that she's stable. You
Mm.
know, moms will tell you it when they don't feel well, if
Yeah.
their blood pressure is dropping or something. They tell you, and then that's when you might say, okay, well, just gonna move baby over here
Yeah.
and check your blood pressure. So that's the culture piece, is that the culture is just to have all these, you need the monitors, but you don't necessarily need them going off as often as you think after baby's been delivered and there's no postpartum hemorrhage and baby and everyone's stable. Um, so we could probably lengthen the amount of time that we're doing blood pressure checks and oxygen and stuff. We don't have to do it every 2 minutes necessarily, because that really impedes the mom being able to hold the baby
Sure.
on the chest with the big cuff right there. And then there's the perceived safety. Like, a lot of anesthesiologists may not feel that they are comfortable being the ones kind of helping mom hold baby and checking, making sure that baby's breathing well and not obstructing. And so for us, there's or for most protocols where in hospitals where they do this more routinely, they have a nurse, like the circulating nurse in the room is there to help, or maybe one of the NICU nurses. It depends on who's there, but they have a nurse there to specifically help with the skin to skin. It's not necessarily the anesthesiologist. We don't have, we've not really ever discussed who should be that person. And I mean, for me, I feel comfortable with it. And as long as we don't have a protocol, I feel comfortable enough to help facilitate it, providing everyone's stable.
Sure.
And my attention isn't required elsewhere for safety reasons. But um, yeah, it's just, I think it's something that we have to just make a priority, because otherwise it's a fairly long period of time when mom is separated from baby, and it doesn't have to be. It's purely just a logistical
Mm.
problem, you know?
I love that moment where you were like, we're doing this. And the nurse was like, we're doing this. And you're like, we're doing
Are we?
this. I'm like slow clapping over
Are
here. I'm
you
like,
sure?
yes. That's so good because you need that, don't you? You need that leadership to be the impetus for change, right? Like you,
Yeah.
and that's
And
what you did.
it's very, I've realized after having been that vulnerable person, not having a C-section, but vulnerable person, not able to advocate for myself during delivery, you just need someone to say, we're doing this. And it can just be one person, but then everyone in the room is like, Okay, sure. Like, you're right. Great. Good. And then it just, so I try and do that now for every delivery that I'm involved, a C-section that I'm involved in. If I ask the mom too, do you want skin to skin? Is this something you thought about? And because we can do it
Mhm.
if everyone's stable. And so far it's been really well received. And just little things, if I can that I can do to help advocate for others, when because I know it's difficult.
Yeah, it is. It is. Even I love that you said even the most confident A-type personality can still, and even medical professional, like you're like,
Yeah, like that's
I
me.
worked
Yeah.
here, like I know you
Mhm.
all, like, but
Yeah,
you
exactly.
still have a hard time speaking up. So you can imagine it might even be harder for people who
Mhm.
are not in a place that they're familiar with and they feel safe in.
Much, much harder. Uh-huh.
For sure. Oh man, I have a question. This is set up sort of unrelated, but I do get a lot of questions around delayed cord clamping with C-sections too. So I'm just curious, is there a protocol at your hospital for that as well? Because you mentioned that that's something you wanted as well.
We do it, I would say fairly routinely. It's a little bit dependent on the OB, but I think for the most part now they all kind of do it, whether it's a C-section or not, um, depending again on the stability of the baby, like how baby is and how mom is too. Like if there's suddenly a lot of bleeding, there's that needs to be your focus as
Right. Yeah.
opposed to waiting. Um, but we do try and do it. It's just interesting to me that I never, like, me personally, like I never even, I don't know if we did delayed cord clamping for my daughter.
Hmm.
I think probably because my OB would have, but on the other hand, like she was a vacuum delivery, her heart rate was really low. Maybe it wouldn't have been appropriate anyway, but I just like I never even verbalized that I wanted it. It's just a strange thing to have all this, have a lot of knowledge and not be able to
Yeah.
not even know what happened with your first delivery because you didn't ask and you
Mhm.
didn't advocate.
Yeah. I mean, I was talking to a really awesome OB here in Toronto, and we did a little podcast interview. We talked about trauma-informed care, and that's her passion. And
Mhm,
her tip, which is one that I now give to all the students, is to do like a cover letter for your birth intentions, aka birth plan,
mhm,
to kind of say, to humanize it, to say, you know what, for example, the woman that was coming in for a repeat C-section who didn't want it and who could say, you know,
mhm.
I'm really anxious. This is the opposite of what I wanted. And
Yeah.
I really feel like I missed out the first time and I'm really anxious and I want to have more skin to skin or whatever it is, right? Like
Mhm.
put that rather than to just have a checklist of like, I
Yeah.
want this, and this. So I guess it's a two-part question. Number one, how do you feel about how can we as patients make birth plans be received better by care providers? Number one, and maybe that's the answer, the cover letter thing. And number two, like, do you ever read them? Like, are you as an anesthesiologist looped in on that or not really?
Mm, hmm. Yeah, interesting. I I mean, this second question, I would say no. Like in general, no, we're never looped in. The caveat being if a woman has a very specific, has a type of medical condition that we need to know about, or that would affect her anesthetic if she got one, or if the woman herself has a reason she wants to speak to the anesthetist, to the anesthesiology department before labor, then we do a consult. Like we see them in advance and chat, and then that's the only situation where we would be looped in because we're talking to them directly.
Mm.
Um, and yeah, I think it is culturally something that maybe just, I don't know, rubs the wrong way is the wrong term, but the idea of a plan in medicine, I think it just makes us uncomfortable because we never want to say like, yes, this is the plan, because we know that things can go awry, sideways. So that it's, for me, I would have I 100% support like women having birth plans. I wish that I had been better at that in my first, or done it at all in my first delivery, because I ended in the exact, um, uh, well, I just wanted to go with the flow, which was the whole problem, I think, with my first delivery. I was totally unprepared. So having thought about those things ahead of time with a plan helps you not end up in that boat. But I think, yeah, your OB's suggestion of having something to humanize it, to maybe put a little context behind it and say, these are my birth hopes. These are my birth anxieties, makes it a little more, like you said, humanizing. And then we can really see the context behind why the woman or the birthing person is asking for X, Y, Z, why that's really important to them. And then if there's for some reason it can't be accommodated exactly the way that they want, then we can at least we now have a way to open the conversation to find some kind of accommodation, some kind of alternative, meet in the middle. But I think the word plan is hard for a lot of, especially obstetrical care, because it implies that things are going to be this way, and they may not be, um, even though you may try really hard.
Yeah.
But I think we also just don't want to disappoint our patients. And then if you come in with a plan, then I feel like a lot of I mean, anesthesia is not as involved, but I feel like a lot of obstetricians might feel like they're setting their patients up for disappointment.
I get
Whereas if you have, yeah, exactly.
Yeah, you have like hopes and anxieties. I need to do a rebrand. I think we all need to do a birth plan rebrand.
Yes, I agree.
Because it's the
Hmm.
purpose of it. It's a decision-making tree in a way. You kind of run
Hmm.
through like an if-then kind of diagram in your brain of like, well, if this happens, then I'm going to do this. And if this happens, I'm going to do this, right? You're just sort of running through scenarios. And therefore, because so many people have said, well, I had a plan and nothing happened, and now I'm really disappointed, right?
Hmm.
So it's like we need to change expectations maybe, but also encourage people to do research and think through what it is that they want.
Yeah,
Hope for
absolutely.
it. Yeah. There's so much to say on that. Oh, I feel like I could talk to you for hours. Hours. You've got a 3-month-old, so I
I
don't get to
do.
keep you for hours. Okay, so let me wrap up with this. What advice would you give to anybody listening to this who's pregnant and preparing for birth? And maybe we'll make it specific to pain management because that is your true area of expertise, as in someone who actually gives epidurals. So, I think I get a lot of women who are kind of like, I don't know what I want because I don't know what contractions feel like, especially if they're first time
Hmm.
mom, right? They're like, I'm not really sure. So, what would you say around anyone in terms of preparing to manage their pain in birth?
Hmm. I think whether you end up having a medicated or unmedicated birth is really neither here nor there. What I think the advice I would give in terms of pain management is there's going to be pain. It's how you're prepared to manage it. And a lot of that preparation piece, as I discovered for myself, a lot of that preparation piece comes in ahead of time. You know there's going to be pain. And if you have a goal, you want to do this unmedicated, or you think like, no, I feel like I probably do want an epidural regardless, you still need a framework to manage the pain ahead of time. And then you're ready if things go one way or the other. If you really wanted an unmedicated birth, but you end up needing oxytocin and the contractions are 10 times stronger than they would have been, potentially otherwise, then you're still managing the pain up until that point. And then you can still decide, I'm going to have an epidural, and it's not a failure. It's just, I managed the pain well to this point. So I think it's a physical preparation. So for example, the breathing work that you taught in your push prep course was invaluable to me. Um, my pelvic physio did a lot of perineal massage training, which, I mean, when I was delivering my second daughter, the ring of fire, it just felt like my perineal massage. Sure, it wasn't comfortable, but but I but I thought I recognize this feeling and I can breathe through this feeling. So the preparation piece physically like that, and then the mental preparation piece, knowing that, just deciding what kind of person you are. Am I the kind of person who is kind of anxious about the pain? And so am I thinking I'm going to want something nitrous, an epidural, or am I not that anxious about the pain and I'm going to give it a go without? So having that kind of internal reflection, I think, is also really important, and the mental preparation piece. Because otherwise, if you go in, you do need to recognize that things could go any which way, but going with the flow, I think, for me anyway, seemed like a very externalizing
Mm.
way to think about it. And I realized after a lot of reflection afterwards, what I was unhappy with of that delivery was that I felt like that birth was happening to me, that I was just an observer. Birth was happening to me, the pain was happening to me. I was not in control. Um, and so the second time I felt like, no, birth is something I am going to do. And then it happened really fast. And I realized as it was happening, like, I am doing it. I'm doing it. It's not happening to me. Like, it's out of my control, but I am controlling the narrative.
Yes, mindset,
Mhm.
you're inner calm and that trust that like you're gonna get through it no matter what.
Mhm.
I heard something that I wanted to run by you, and I have started to share it with students in this idea around pain, like when you're going into birth and thinking of two dials. I've got my hands up right here. And what
Okay.
you want to avoid is on one of these dials, it's willingness to experience pain. And this pain,
Mhm.
this one is actual pain itself. And what we want to avoid is having both of them turn to zero. So if you're going
Mhm.
into birth and your willingness to experience pain is zero, and you want to experience zero pain, then you're going to have a problem. What we
Mhm.
really want is your willingness, your openness to experience pain to be really dialed up to like a 10. You're like, I'm here, I'm going to surrender to this. And you're
Mhm.
willing and you're receiving it, and your willingness to experience it is again on the other dial at 10. Then you're kind of going in and you're going to be able to cope much better than if you're anxious
Yeah.
about feeling any tiny little tweak,
Mhm.
And I thought that was interesting because it speaks to the nervous system and the
Oh,
mindset,
yeah. Uh-huh.
right? Around it.
Yeah, that's so true. That's a great way to think about it, I think. Mhm.
Yeah. I mean, gosh, there's so much I could talk to you about my other stuff and my experiences with propofol and fentanyl and my IVF and my egg retrievals and my heart surgeries. And I have so many amazing experiences with
Mm.
anesthesiologists in my life. So thank you for all that you do. And I'm just really grateful for your time today. I know it is hard to come by, so I appreciate you so much. And I know that this is going to help so many people listening.
Oh, thank you. I appreciate you more than you know, and all the work that you do for women everywhere. I appreciate it.
Thank you, Doc.